We are creating apps and number of application in this domain. We have a big project, but some of the experience we want to share with you. You can see this is my website. It's still not live because it's under process, but in this website we are doing different types of condition in this HIV. If we talk about the HIV, so in India it's really big and taboo topic, because whenever we are doing HIV, then we found many things. First of all, HIV is not it's not spread by touching, it's not spread by using food, and it's not spreading if you are living with each other without creating sexual relationship with each other. Actually, HIV can spread only if you are doing unprotected sex with any infected person. HIV can impact if you are using needles, more than one person using same needles. Otherwise, HIV can infect if you are transfusing your blood. You are getting the infected blood from other person. HIV can spread using if you are if any lady if you give the birth to a child, otherwise they are breastfeeding also. This is also cause of the HIV. So HIV can spread only these regions. If you are living together, you are sharing towels, you are sharing a room, you are sharing some bed without creating any type of the physical relationship, and if you are using say, clothing, then that's not a cause of the HIV. So HIV is not a disease which can spread by breath. So yeah, it can be. It's not in air. So HIV is not spreading like that. So these are the myths. Just you can see these are the myths in the India, in other area. HIV is a really untouchability illness, and it can be spread by air. No, it's not right. HIV can spread only these some regions. If you are doing protection, then obviously you can save your life. You can you have to apply the caution if you are doing this type of activities. So whenever we are doing researching in this HIV field, then we found many things. What is the real reason of the HIV? This is really impactful point, and it's really surprised me and scared from this point. If we talk about the USA, then in USA, a very big amount of the person are infected with HIV. In USA, obviously parties and late night parties, pub. There are a number of happening things there. But whenever you are going in this party and you are taking alcohol and you are creating sexual relationship with someone, so you can infect it if you are doing this type of relationship unprotected way, because obviously you don't know more about it. You don't know more about that person. So that's the reason we are creating an app. In this app, we can found how many person who are infected this illness. So you can use this app and you can know what is the percentage of the person in this party and this my 1 or 2 kilometer areas. You can protect to yourself and you can be cautious of this activity. So that's very important. Second part we are creating in HIV, because HIV obviously infection, first cause and main cause is the unprotected sex, and this happen in the 15 to 18 years age. Why? Because teenagers teenager girls always infected, always doing wrong activity, always doing wrong unprotected sex, because they don't know more about this. So this is a very important. They should know about this danger. They should know about this problem. So that's a very important. Parents should talk with them. Teachers, we should talk with them. So this is a very, very important. So we are creating an app to help the parents and teacher. We can because obviously this very taboo topic in India, and parents are not comfortable to talk with their children about this topic, and they can teach them what is the danger of this topic. So we are creating an app. They can this app will help to parents and teacher. Then they can understand what is the danger, and they can convince their children, and they can help their children, and they can teach about this, because in a 14 and 15 year age, this is a teenager age, and hormones changing is a big reason to get anxiety and curiosity, and number of questions are rising in this field, or because obviously there are three sources we can find the answer. So first of all, our parents, second our teachers, and third our friends. So parents always not comfortable to talk about this, teachers are also avoiding this topic, and friends are also with same age, so how can they know right information? So always they provide wrong information, they provide always wrong your guidance, so that's why it can be go in wrong activity and unprotected sex, or that's the reason you can infect HIV and they can obviously go in the danger. So that's a very important, we should provide right information to our children. So for this we are creating an app to parents, they can understand what how can we teach and convince and counsel to our children. And we are going to organize using this app, using this bot. We are creating some workshop and seminars in school and colleges, then we can try to counsel number of students undergoing the school, undergoing the college. They can understand how can we can cure this disease, and how can we save to ourselves, and how can we deal these issues. So we are creating this type of apps in my domain. But if you are infected with HIV, then what should we do? Actually, depression is really big point, because whenever you get to know you are infected with HIV, so you are start to, okay, now I am the out of this society, no one will talk with me, no one will create relationship with me, no one how can we share with my parents, how can we share with my friends, or if anyone know about this, then obviously he will or she will avoid me. So you can understand now you are out of the society, and it will create depression, and cause of this number of person can commit suicide, because they understand, okay, HIV means AIDS and it's last of the life, and okay, finish this life, finish. So they committed suicide. So we have to teach them, we have to counsel them. No, that's not means if you have HIV infection, that's not means your life is ends. You can share your problem with anyone, you can talk with anyone, you can, so first of all, you can share your problem with your parents. You can know what is the HIV, how can we cure this HIV. If you have HIV positive, so don't worry, you can immediately start your ART means antiretroviral therapy, and whenever you start this therapy, then automatically your HIV virus will start to going down, and your immune virus CD4 cells going to increase start. So whenever you increase your anti-infection viral and your HIV infection going to down, then you can live very normal life. You can go, you can create also relationship with others also. Because if you are taking this therapy, then your HIV virus automatically going to weak, and it will not spreadable from mother to child or sexual relationship. So you can live long life, you can live normal life, and you will never go in AIDS state, because your HIV is available in your body, because HIV can never go from your body. Still you have no any therapy and we have no any cure, because you can cure fully from the HIV. But starting this therapy, your HIV is available, but after that it's not transmittable, and it will not impactable, it will not affect your body, it will not spread by any activity from your body to another body. So that's why if we start this therapy, you can save your life. So don't worry if you are infected with HIV. But problem is that you don't know more about it. Whenever you get positive with HIV, then you start going to in deep thoughts. Okay, we are not able to. Someone want to ask, please? Yeah, anyone want to ask? Okay, let's continue. So we are talking about the HIV. So now we are creating a bot. Bot will help you to give answer in this condition. With help of the bot, you can know about the first stage of the HIV, how can deal with HIV, how can start your therapy, what is the number of number of centers in India also. Then you can take help and you can go counsel, and your obviously your diagnosis also start, and you can start your therapy. And this type of answer you can get by this bot. So we are creating this bot using the machine learning and using the Flutter also. We are creating a clinic software also. Clinical software means we are creating a software which monitoring your HIV progression. HIV progression always depend on your CD4, means the CD4, these are the our cells which always help. These are the create to immune system, and it always must be strong. So it should be more than 200. So if your CD4 cells are not going to down, then you are still strong, and you can fight this infection, and you can go with your normal life. But if your CD4 is going to down and your virus count of the HIV going to increase, that means you are going to the AIDS stage. So that's a very important, that's a really very important, it should be monitored. So we are creating a clinic software who can monitor, because whenever you go into any area in any lab, and you will get the tested, and or you have to regular test it, because the doctor also want to know, okay, your ERT means antiretroviral is going in right way, and it will be impacting on your body or not. So this is very important. We must have to regular, we have to monitor time to time. But if you are going in the lab, then there are number of the records, means 1,000, 2,000, 10,000, sometimes it's a 50,000 records are there. So this is not possible by human. They can know about your particular record, and they can monitor to by yourself. So that is a very important. We want to create a strong software. We want to create a strong application. They can monitor each record. What is the right now condition of your HIV virus? Because HIV impacted, HIV increasing model, HIV impacting always different in a different body. If you have already diabetes, if you have already cancer issues, if you have any TB issues, then obviously HIV increase very fastly. And if you have no any type of issues, then your HIV is not increasing in a fast way. Of HIV convert into AIDS, it will take time 7 to 15 years. Sometime it can be no time, but minimum it will take 7 to 8 years, and maximum 15 to 16 years. If you have HIV and you know not taking the proper treatment, then you obviously you will get the AIDS. But after that, HIV will develop in AIDS around in 15 years. So this is a lot of time, the big time. You can cure, you can save your life. This is a very important. You have to take this medicine regularly. You have to monitor your regularly. You have to monitor your HIV progression. So we are creating the app using the machine learning and Flutter. Then you can always you have to regular blood test, and you can know what is the progression of the HIV. So you can be more alert. So these are number of applications we are creating using the machine learning and Flutter. They can help, they can prevent, they can save your life from the HIV, and they can be saved from the AIDS also. That's a very important. But whenever doing this research, then we did some research in area. Then we got some feedback. We have to do survey. So a lot of cases, a lot of we found. Then so we met someone, number of person we have met, but we met someone, we want to share his story. He is a software engineer right now living in Bangalore, and he is from the Delhi. We should not disclose his name, but I want to share his story. He is gay and HIV infected, and right now working in NGOs also to prevent this condition. But they committed suicide 2 times. Why? Because whenever he was in 13 years, then obviously he is gay, so involved in his best friend in sexual activity. But his teacher say and catch this doing this activity, and immediately say, why are you doing this activity? And well, they punish them, and okay, it's okay. They give the warning, oh, it's okay. Now next time you should not do this, and skip that. But after some time, his seniors also know about this, and they started sexual abuses him, and started some sexual not abuses, and he is really going in the depression, and because he could not say anything, could not share anything with his parents, with his teacher. So after some time in 12th year, in 12th standard, he tried, obviously he committed suicide also. But okay, fortunately he said it's not success committed suicide. So in college life also, he found, and okay, always some it's okay, we are not feeling good, we are feeling always fever, infection. So one time a doctor say, okay, you should check, because you are a gay, you should check yourself HIV, because obviously whenever you are HIV infected, then your immune system is going down and you infected very fast. So he tested and get the positive in HIV. Then after that, again he thought, okay, now life is end and we should obviously commit suicide. And again he tried, but fortunately he also not succeed in this activity again also. So after that, he started to search what should we do, what, and after 1 year he started his treatment. Why? Because in full 1 year he going in the deep thought, and their professional break, and relationship also are going to down, because obviously he is not comfortable to talk with anyone, with parents, with friends, anyone. He is not comfortable to talk about this. After 1 year he got the counselor, and after that he understand, okay, now I should talk with my parents. And after that he started the treatment, and after that now he's living good life and working as a professional software engineer in good company. So you can understand how can he spend 1 year in a dark mood. So this is a very important, if you know about the right way in a time, on the time, so obviously he can be better. So this is a very important. After that I have to I have to start this application. I understand, okay, we should create number of apps, we have to create number of application who can help like that person who is not actually know what should we do if we are get positive in HIV. This is a one case. Now I want to talk about the second case. What is the second case? Second case about the migrant person, about the sex worker who are, who don't know more about it. So migrant person like a truck driver, some mazdoors who are living in metro city like Mumbai, Delhi, and living their home. So they always involve in like that sex activity and always go in the sex worker. They are not and using any precaution. So obviously they are also infected, and whenever they go to home and they spread their disease to their wife, their children also. So obviously they also don't know. So we are doing research in this field, but still we are not getting right answer to convince like that person. So we are welcoming your idea. If you have any idea, if you know, okay, we should do something, and you have an idea using the IT, using the other way, you can share with us. And basically my full team are doing in this field. So if you have any idea to protect this type of diseases to migrated person, they are not proper educated, they are not using any type of bot, they are not using properly mobile, sex worker, they are always avoided like that things, and they are spreading this disease in very danger way. And wives, obviously we are involving in this type of activity. So if you have any idea, please share with us. We will do this, we will work on this, and we will create something with help of your idea, with help of your efforts. So this is a statistic of the, you can see, this is a statistic from the 1990 to 2020 death caused with HIV. HIV infected children under 5 years because their mothers are infected, and from the birth, yeah, breastfeeding are the main cause to infected these children. Women's, they are not involving in sexual activity or involving in sexual activity, but after they are infecting because they are living with HIV person. And total population of the infected person in HIV India, you can see it's increasing order. And it's a very surprising area. Now, last year, survey in 2000 21, we found that Bangalore is the biggest burst in HIV infected area. Really, it's really big problem. Why in Bangalore? Because Bangalore is a very educated city, and working professionals are there. A lot of working professionals are there. After that, HIV increasing, speedily increasing in this field. So we have to understand this thing. So it's a research topic. Still we are developing topic. We are doing number of things in this part. You can support with us. You can do something in this area. You can take directly advice, and you can start research, and you can start any type of help. So you can connect with me in this session. But in a one session, it's not possible. I can talk about the technical, about the social topic in this. So in this field, in this session, I'm just sharing statistic, information, problems, because data science, first of all, get the issues, first of all, get the problem. After that, we will take some section to solve these issues using the Flutter, using the machine learning. We will create the bot, we will create the mobile apps, then it can be help, it can be solve this issue. So if we talk about my website again, just a minute. This is my website. So we are creating mobile apps also, and this is a dashboard. And you can see we are organizing some talk with bottles created using the machine learning. And we are also organizing some workshops, seminar in school, colleges, section or sex workers area. Then they can understand the danger of this disease and they can do something. So whenever we talk with bot, you can see this is a bot, this is a chat bot who can help, who can give answer in this type of issues. So how can we create a smart bot using the machine learning and Flutter? How can we solve this type of issue? We have to improve. It will discuss in next section. If anyone want to ask, if anyone want to share something, please discuss with me. I'm here. We can discuss about this. It's really very sensitive topic.
Hi Geeta. Actually, we have few questions in the Q&A section. First question is, how will anyone know the other person is affected?
Yeah, you're right. This is very tough to know. Okay, the second person is infected. So that's why we are creating app. You know, in a COVID area, we are using this app. In a 1 kilometer, if anyone is affected, then your app immediately notice me. Okay, you will get notified. Then in 1 kilometer, these are infected person. So we use the public data because in the USA, in India, it's not right now started, but in USA area, all HIV patients are registered in a digital way. So they are creating their app, and in this in this app, we can know in 1 kilometer area and 2 kilometer area they are the HIV infected. So obviously we don't know more about our partner, but we can at least we can take protection, and we can get the precaution if you are doing this activity.
Okay, second question is tagging HIV negative sex worker so that someone else is not affected and routine checkup has to be done.
HIV can never curable, because HIV, if you have a HIV, if you got positive HIV, then not possible you will get 100% cure. But yeah, your HIV virus can be week to week, so it's not spreadable. So if you are doing sexual activity without protection, then it's also HIV. It's not strong, can be spread, and it will not spread also from mother to child if you are doing treatment properly. If you detect, if you find then HIV is not positive, then it's possible, because sometimes HIV going to so weaker and not immediately detect your test also. So you can understand, okay, it's negative now, but actual HIV can never be negative if you once positive. So always in a full life, you take the medicine and you have to take the antiretroviral therapy to maintain this, to manage this.
Geeta, from the Q&A session, we have only these two questions. But from my side, I'm also a data scientist, and I'm just curious to know that how do you use ML in HIV? Like what do you like? Do you have any kind of model you're working on, Can you just briefly tell me about how do you do that?
Yeah, absolutely right. Actually, we are doing research in Indiana University, Purdue University in Indiana. So they provide me data, and data is also available in WHO site. So we are getting this testing data to know more about this. And whenever we are involving in this type of process, we are connected with Purdue University in Indiana. So they are doing research, and after that we got after that they will get the result, and after that they will spread in other area, in other medical sector also. So we are a team. In this team, some Indiana research and some USA doctors are available, and some in Bangalore based and Mumbai based doctor are also available, and some data scientists are available in my team.
Uh, that's wonderful. Actually, you guys are taking very great initiative to resolve this biggest world problem.
Yeah.
Uh, I think is this end from your side? Because I think we don't have any other questions in the Q&A part. And okay, so we have got one more question. What precaution for healthy person?
Precaution in a healthy person, always take the right food and right activity. But if you want to cure from the HIV, you want to protect yourself from the HIV, then you have to take something. First of all, you never apply more than one sex partner, because some person always involved in this type of activity more than one partner, so it will be really risky. So always you should one partner always, it's ideal also. You should always go with one partner in sexual activity. If you are doing this activity, you always should if you know you are doing this activity in parties and other areas also, then always use precaution. And whenever you are using the blood from other, then you have to must careful, and you have to check, because thalassemia patient always need bloods. So and also in this field also we are doing research, because blood should be really big source of to infection. So this is a very important. If a blood transfusion is blood transfusion is, then it's a very important. You must have to careful about the blood. And whenever you are using any needles, then this is a very important. Only one person use one needle. After that, this needle should be destroyed. One more thing I want to share. In a Bangalore and Pune, Maharashtra also, we found about the HIV. And one more cause we found, then they are using drugs and taking drugs, and using one needle for more than person in parties. And so you can understand it can be really harmful. So using this needle can be give infection, not only your drug also, and it can be give infection about HIV also. So must be careful. Just avoid alcohol, must avoid the drug, and must avoid multiple sex partners.
We have a few more questions posted. So,
Mhm.
how are you doing your research? Just an open-ended question. Uh,
And goal of your project, what is the end goal of your project? Obviously we are want to create some application to help the parents, because we found, especially I'm also concerned about this, because in India parents are not comfortable with their children. If parents can convince their children about the risk and curiosity about this activity, then obviously children can understand, and they can protect their life. I shared one person story. He committed suicide 2 times because he could not share anything with their parents. So this is a very important. I'm creating a special board to especially parents and teachers. They can understand the risk of this, and they can counsel their children. They can help their children in this type of activity, so they can save their children. So this is my first goal. Which method are used in this project, like regression and classification? Which one is okay? So I am using number of models. Like first of all, I used logistic. It's not a very big algorithm. So random forest and decision tree are also very good algorithm we can use. Support vector machine is also very helpful, but in a different domain is a different. Like a clinical software, we are using KNN algorithm and TensorFlow. But in a bot system, if you want to know about the progression about the HIV, then we are using in a simple way clustering and random forest.
We have few more questions from the Q&A part. What precautions should one take, and what meant that infection spread only to those who have more than one partner only? Maybe you can refer to the Q&A section. Can you see the Q&A tab?
Yeah, sure.
Yeah, so you can go for the
Then
third question directly.
Yeah. Such case in data science ML model. What should be done in such case in data science AI model? Actually, in a data science, we can do many things in the research part, because obviously HIV is still researching topic, because it's still we are not getting the right solution. Yeah, we got one solution, transferring. Stem cell transferring is a very good way to 100% cure of HIV. This is a very good news. And still we are saying that HIV is not curable disease, and if we come in your body once, then it will never cure. But 3 cases in all over world, 3 crores are infected in all over the world, and only 3 cases in world who they are perfectly cured in this disease using the stem cell transferring. So we are doing research using the AI machine learning. So we have to find the perfect match, because if you are transferring wrong stems in person, wrong stem not means you are accepting your stem from an unknown person, means to your race, your nationality, your genes are also very important. So using the AI and machine learning, we can monitor and we can find out some person who have by default HIV resistance. So we can use his stem transferring. We can use this method in a proper way, so we can cure this disease easily. But it's not possible, because it's a very difficult to find some right person. So in that condition, we have to monitor using this data about the CD count, and if you are doing right way of the exercise, you are taking the nutrition food there, and you are taking some yoga also, then you can also prevent your life and you can increase your immune system. But after that, this is a very important, you have to use ART, antiretroviral therapy. So using the AI, we can monitor our body, and we can monitor our all virus load in our body, so it can be real helpful. ML making the right now, because using the ML, we can find the relationship between data. So your progression of the HIV in AIDS totally depend 2 factors. First, increasing of HIV virus, and decreasing of your CD cell for immune system. So if we are taking the right machine learning, like if you are using the deep machine learning, if you are using the simple machine learning, unsupervised machine learning, also clustering method, so you can monitor your both virus count, and you can take right therapy to save your life. So this is a very important. So machine learning model can monitor your virus issues. And once again, I want to say, well, mobile app, Flutter, we are going to make a Flutter app. And first of I already told you, we are creating app to especially parents. They can help their children and save their life. So we are creating using the Flutter app. But still we are facing the issue. We could not properly connect with migrated person, with migrated families, with sex worker who are living in very down area. So if you are getting any idea, please share with us, because we are looking for this type of idea in this subject, and it's really typical to reach out that person and reach out that type of issues, because they are not registered person also. They are never start their treatment proper way. They never check their HIV. They are infected HIV, but after that they never tested, and so this is a very big issue. So if you have any idea, then you can do something. Please share with us. Yeah. Anyone want to ask anything? Is naive-based classifier used as HIV analyze? Of course. Naive-based is a very good algorithm to create bot system. So we can use this. Actually, we are creating the app using the Flutter in my next session. In this session, we want to discuss about this topic, about this sensitive topic, and danger and cureness and statistic. So just I told you in a Bangalore, you understand why Bangalore is a very, very effective area. So obviously we have to understand the statistic. Using the Flutter, we can create mobile application. Flutter is a very nice application. Flutter is a open source framework provided by Google, and it can be applied in all type of framework. If we create the application in Flutter, then you can use in Android phone, you can use in iPhone, and you can use in desktop also. So we want to create an app which can be run in any type of device. That's why we are using the Flutter. Using the Flutter, we can take over the website data also. So that's why we are creating in the Flutter. Flutter is a real good technique to make this type of application for all devices. And machine learning is a model, and machine learning model we can directly connect with Flutter. Flutter can take machine learning data using the JSON format. So it's a very easy to do this application. What should be done for the such case in data science ML mode? Actually, data science mode, there are number of applications are creating already in this area. Just I told you, Bangalore is a very big area. So using this application, because all data who are positive in HIV, so registered in a central way, cloud way. So using this data, we can create a multiple application. And one more thing I want to share, because HIV infected male could not create relationship with a normal person, because he always thought he is not able to create relationship between you can relation with a normal person. So my some team members are creating some dating site for HIV person also. Then because the HIV infected male and HIV infected female can also create relationship and without any impacting their life and without creating any issue. So we can create some data, we can create some dating site, we can create some help, you can create some counseling center, and we can creating some ML model to monitor the HIV progression, and we can get some what is the very simple application, COVID detection. You are coming from the traveling and anything Arogya Setu, so we can create a very simple app using Flutter and machine learning also. You can take personal prediction about HIV. You can be positive or not. You can get some little bit knowledge using this app also. Still, we are working actually on this stage. So right now we are not thinking about the marketing strategy, because obviously whenever we succeed in this research area and created this apps, and we have to connect with some doctors, some counselors, some NGOs, they will help us and they will marketing our apps. And obviously this is not a business model, this is not a scalability model. Obviously it will be free of cost. So we have to share with some health sector personnel and some NGOs. They will help us to marketing this type of app and this type of issues to understand. The next session we will obviously discuss about the technical part, some hands-on.